it's common. Fever is a very common symptoms as well as signs. لكنه متشعب. We always, when we have يعني a big topic, we try to get the most out of it, okay? Whether to develop sort of approach or sort of what the red flag or how to يعني work up this symptoms, okay? So those are the learning objective for today's lecture. Okay, so I'm just gonna read it, the coming three cases back to back, and then I will try to explain why I put it there. So Abdullah, 23-year-old male, medical student, presented with a productive cough, dyspnea, chills for 3 days. He has no past medical history. His vitals basically stable except the oxygen saturation of 92%. Chest, bronchi in the right middle lobe. Chest X-ray is pending. ABG showed just mild hypoxia. What do you guys think the most likely diagnosis here? Yeah, pneumonia, or in particular community-acquired pneumonia. أحسن. Okay. So, 23-year-old medical student came in with dyspnea, chills, weight loss for 3 months. Okay. Vitals, he is febrile. Chest is clear. Head and neck examination showed right subclavicle lymph nodes. Chest X-ray pending. ABD basically unremarkable. What do you guys think the most likely diagnosis is, or what we are concerning about? Could be cancer, yeah. In particular, which cancer? Given the age and the complaint. That's reasonable. I know you guys talking about virtue notes. يعني it's a good thought. But even before that, ركزوا على الage والphysical examination finding. Okay, I was thinking about lymphoma. Okay, so you have lymph node enlargement, middle age, with fever and weight loss. Okay, how about this? 23-year-old medical student presented with fever, progressive dyspnea for 3 months, now dry, and he has symmetrical small joint polyarthritis. Okay, no past medical history, vitals showing fever, chest X-ray decrease breath sound to the right base with a stony dullness, pending chest X-ray, ABG unremarkable. What do you guys think the most likely diagnosis? Possible viral infection. I was thinking about something like rheumatoid arthritis. Yeah, RH, rheumatoid arthritis, RH. But you guys hopefully get the point by now. Those 3 cases share a lot of similarity, one of which is basically the fever, okay? But the details is made us thinking about different possibility from infection to non-infection causes, okay? So the fever is basically just a sort of symptoms or signs. It's like only the tip of the iceberg, but what's behind it or what's below it, we need to investigate further. And the key is by the history and examination, okay? Okay, so let's talk about fever. وبعدين نرجع what's causing the fever, okay? So what's antibiotic? Antibiotic, the definition, is that substance that reduce fever, okay? And the antibiotic cause hypothalamus to override the prostaglandin-induced increase in temperature. So what happened in fever is basically the prostaglandin in the brain gonna induce increase in the temperature. This is one of the way we fight bacteria, okay? An antibiotic is basically asking the hypothalamus to override that. Can you give us some examples of antibiotic? هنا أمثلة مضادات الحرارة. Voltaren, okay, so what's the family for the Voltaren? Paracetamol, good. Okay. Diclofenac, Voltaren, Belvi, all under the category of what we call it NSAID. Okay. Okay. So those are the common two medications group we usually use as an antibiotic. Okay. So let's compare the twos. I think it's always useful to compare it because they are very common being used in practice. So both can be used antipyretic. NSAID have a strong anti-inflammatory property comparing to the acetaminophen. This is the Tylenol. And for that, if you have someone with fever, but also they have an inflammation process and you would like to settle it down, NSAID will be a good choice. Metabolized by the liver and the kidney, while the acetaminophen mainly by the kidney. Serious side effect with the NSAID, we talked about bleeding, as well as AKI with the acetaminophen, acute liver failure, okay? So what's the difference between fever and hyperthermia? Well, fever is basically resetting the thermostatic set point in the hypothalamus, okay? So you are resetting the point. Hyperthermia, it's a true elevation in the body temperature, okay? What's happened in the absence of resetting the hypothermia. Is the difference clear, guys? اوكي طيب
بس عندي سؤال يا دكتور.
يس
هايبر ثيرميا، الفيفر تعتبر هايبر ثيرميا صح؟
So it's a kind of two different terminology. Hyperthermia is just the body is get elevated, but if you check the temperature, you will have fever. Okay? But the fever by the medical, as a medical term, is basically resetting the thermostat set point.
تمام.
It's a kind of the fever and the hyperthermia is a result. Okay?
يعني
بينما
لو واحد جاء عنده ضربة شمس
yes
يعني هذه تعتبر هايبر ثيرميا.
Exactly, because there was a rise or there is an elevation in the body temperature. Yes.
تمام شكرا.
Okay. يعني why we are giving this discussion to begin with, if you're going to treat hyperthermia, you probably shouldn't treat it with paracetamol, اللي هو acetaminophen and NSAID, because there is no problem in the thermostat's setting point. Okay. Yes, the way is basically to cool down the body. Okay. So it's an old study, really old study, but really give us the foundation what to call fever. Although there is a lot of controversy, there is no clear-cut points in the temperature to say above it is considered as fever, okay? But what this Maxime did is basically analyzing up to 1 million people. So it's a huge, large study, okay? And they identified that 37 degrees is the main temperature in healthy adults, okay? And this is in the axillary, okay? Not in the head, not in the ear, not in the mouth. This is axillary, okay? So they concluded that probably a temperature reading above 38 degrees will deem as suspicious or probably febrile. And as of now, we're still lacking of this clear-cut definition of fever. Some people, they will choose 38, other 38.3, others 38.5, other 38.7. Each reference will have a different cutoff, okay? So when it comes to the normal body temperature, there is some caveat. You have to understand it. A rectal temperature usually is higher than the oral reading. التمبانيك اللي هو عن طريق الإير usually it's lower than a rectal and lower of course than an oral. Okay, so when you put them in the thermostat, basically the lower would be tympanic, بعدين الأورال بعدين الريكتال. Is this clear, guys? طيب الحين نبدأ موضوع. I thought it would be very reasonable to approach fever by understanding a fever of unknown origin. Okay, a fever of unknown origin basically refers to this condition which patient has elevated temperature, but despite all the investigation by a physician, no explaining has been found. Okay, and you can see there is a change in the definition of the fever of unknown origin, and a main change not on the cutoff of temperature, not on the duration, but actually when to call it fever of unknown origin. So they used to say in 1961, you need 1 week of study in hospital or 3 weeks as an outpatient. Now they are saying 3 outpatient visits with 3 days in hospital. Only 3 days in hospital without a clear cause for the fever, you might start calling things fever of unknown origin. Okay. So what's the cause for this fever of unknown origin? Well, before calling something fever of unknown origin, عندنا كده major classification. So classic one, we have 3 major causes: infection, زي endocarditis, TB, abscess, neoplasm, as well as connected to disease, زي rheumatoid arthritis, vasculitis, lupus, GCA. Okay, so دول تقريبا يشكلون 30%, 30%, 30%. هذول بالكلاسيك. But for those people in a healthcare setting, مثلا الناس اللي they are in hospital for a long time, okay, we started to think about other more common causes like drug fever, because usually people in hospital, they will receive a lot of drugs. Septic thrombophlebitis, okay, deep venous thrombosis like DVT, okay, sinusitis, especially اللي عندهم NG tube, okay. So those are a kind of heading causes for fever for hospitalized patient. بعدين نبدأ بالناس اللي بالنيوتروبينيك، الناس اللي they have a very low white blood cell and low neutrophil, okay. We think about bacteremia, opportunistic fungal infection like aspergillosis and candida, بعدين drug fever and DVT, okay. So you see here, for example, in the neutropenic, we haven't mentioned anything about rheumatoid arthritis or connective tissue disease. And population risk factor change, and common causes change. But despite that, bacteria always been one of the causes. HIV, for example, again, we are talking about opportunistic infection like CMV, Cryptococcus, TB, atypical mycobacterium, toxoplasmosis, okay? So based on the risk factor, based on the main category, the potential causes can be different, okay? So look at the etiology of fever of unknown origin over the last 40 years, okay? From the 50s, 70s, 80s, 90s. Look for the infection. Haven't changed much. يعني من 25% إلى 35%, okay? Probably it's decreasing. يعني a trend, it's going down, okay? Look at the malignancy. So it was 19, become 14. So خلنا ناخذها واحدة واحدة. Do you guys have any potential explanation? ليش infection was a common cause in the 50s and now become less common? Anyone can have a guess? Good guess, good guess. Or يعني early antibiotic use and early detection of the infection. Good guess. How about the malignancy? MashaAllah. Very good guesses. Vaccine, prophylaxis, early detection. مثلا مع الكولونوسكوبي والماموجرام والاشياء هذه. Good. وايضا الاكسسبيلتي تو ايمجينج يعني هي السي تي والاشياء هذه. Good. لاحظوا الانفلاميشن they are on the rise as a percentage and probably they are on the rise because the other two big category are actually going down. Okay. Okay. So لاحظوا من ناحيه الانفكشس as a causes in the fever of unknown origin. Okay. Just pay attention. How many abscesses do we have? Really, when we talk about infection causing fever of unknown origin, always think about abscess because an abscess usually they are not responding well to antibiotics, so they're going to remain febrile. The abscess, the cornerstone to treat abscesses is basically by drainage, not by the antibiotic. Okay. أيضا لاحظوا الأسباب الخفية اللي sometimes people يعني not looking into it, like things like endocarditis, okay, or osteomyelitis. Those are a deep tissue infection, might be not obvious clinically, okay? So you'll have to have a high suspicion for them and try to detect where they are so you can treat them appropriately, okay? Tuberculosis, fungal, malaria, toxoplasmosis, all are a very common causes for fever of unknown origin. Collagen vascular disease, we're talking about adult cell disease, lupus, giant cell arthritis, polymyalgia rheumatica, ankylosing spondylitis. Those are under the collagen vascular disease category, as well as طبعا الروماتويد arthritis والواجنر granulomatosis. Okay. A third is malignancy. Always think about lymphoma. Again, lymphoma usually is just a lymph node enlargement. Okay, so you may not detect it even clinically. It might be يعني inside the body. So always think about lymphoma, renal cell carcinoma, and hepatocellular carcinoma also being one of the common malignancy can cause fever of unknown origin. Okay, miscellaneous cause. Think about drug fever. يعني especially for inpatient, especially for patients are in a hospital. DVT, also things get missed often, especially for people hospitalized for a long time, okay? So how to evaluate for fever of unknown origin? When you encounter someone with this fever and all the investigation are still negative, okay? We really have to do a careful history and physical examination, okay? And it should be repeated. يعني you do a careful history and physical اليوم, they're still febrile, bring them back to the clinic, another careful history and physical. We're still trying to wait for this disease to declare itself, okay? And history should really يعني include recent procedure, surgeries, any foreign bodies or implant in the body, a state of immunosuppression, any travel history, any animal or other exposure, including puppies, what's the dietary habits, any change in their diet recently, any medication, even if they are over-the-counter medication, any herbal medication. The history, usually it's basically trying to hunt for a cause for this fever of unknown origin, okay? قديما كانوا يعني they spent a lot of time in what we call it the pattern of fever, okay? Is the fever continuous? Is the fever remittent? Remittent يعني يطلع وينزل يطلع وينزل يطلع وينزل. Is it actually indolent؟ يعني يطلع ويرجع للمستوى normal، يطلع وينزل مستوى normal. Again relapsing, comes and goes. بس with time we يعني find out that those patterns are really non-specific and not diagnostic for any يعني category. طبعا there is still some of the diseases, they will still have some pattern, but we kind of not focusing in the pattern that much anymore. طيب, this is just a suggestive initial diagnostic workup. This is if the extensive history and the physical examination didn't suggest any diagnosis, okay? So if you, for example, did a thorough history and you find out that, oh, they're recently started on drug, so you can say, maybe this is drug fever, I will stop the drug. You don't have to order all of these investigations. But if you did a thorough history and physical, and there is still no cause or no potential culprit being found, this is a good start for the workup. So CBC with differential, blood film, and should be reviewed by hematopathologist, routine blood chemistry, or what we call comprehensive blood work, urine analysis and microscopy, blood culture as well as urine culture, ANA and rheumatoid factor, HIV, cytomegalovirus antibody, as well as heterophil antibodies test of mononucleosis suspected, Q fever serology if there is a risk factor, chest radiography, and hepatitis serology of if there is abnormal LFT. And this is one of the proposed approach for fever of unknown origin. This is quite, I think, relatively old. And it's been there since 2003, but it's still holding a lot of truth, okay? And it's a very reasonable, practical approach for fever of unknown origin, okay? So if the fever persists for more than 3 weeks, this is all definition, but let's say you call someone have fever of unknown origin, you have to stop all the unnecessary medication. Always blame the drugs. If the fever persists, well, you can proceed with abdominal CT, looking for intra-abdominal abscesses, because it's one of the common causes for a fever of unknown origin, as well as nuclear scan, looking for basically abscess in anywhere in the body, okay? If both were negative, you have to ask yourself, is infective endocarditis suspected? If yes, try to apply the Duke criteria. That will include doing an echo and obtaining a blood culture, okay? If no, or this become negative, you proceed with leg Doppler, because we said DVT is one of the causes, hidden causes for fever of unknown origin. If there is no DVT and the age, oh boy. معايا يا شباب؟ Guys? Okay, so if the Doppler is negative, if the Doppler is negative, if the age is above 50, we are doing TA biopsy. So what's TA biopsy? A temporal artery biopsy, because we are thinking about GCA, again, one of the hidden causes for a fever in basically old age, relatively old age, above 50, okay? If there is really all the above were negative, you may even consider doing a liver biopsy. And back in the days, قديما حتى كانوا يعملون laparoscopic, يعني they do actually laparoscopy for the abdomen, looking for basically a small collection causing the fever. This is a very صراحة nice approach. I will recommend everyone to يعني memorize it by heart and apply it whenever they encounter a patient with fever of unknown origin. Okay. طيب. Let's talk a bit about the prognosis. Well, the prognosis, of course, heavily determined by what's causing this fever. Of course, the worst outcome is out of the neoplasm. If the fever of unknown origin patient remain undiagnosed after an extensive evaluation, this is generally actually good sign. This is favorable outcome, okay? And usually the fever will resolve in 4 to 5 weeks. Usually those are a seasonal viral infection will resolve spontaneously. And again, this is after an extensive evaluation, okay? We know that a definite diagnosis is lacking up to half of patients of fever of unknown origin after extensive evaluation. So, acknowledge that and be humble about our lack of ability to detect all the causes. And usually a duration of more than 1 year is unlikely to be caused by infection or malignancy. Okay? To summarize, fever of unknown origin can be a diagnostic dilemma. Infection compromise up to 30% of cases. Diagnostic approach should occur in a stepwise fashion based on history and physical, and patients that remain undiagnosed generally have a good prognosis. Okay? Question, guys.